Hi, I'm Dr. Suvarchala. I am the Scientific Director at Ziva Fertility Centers. What causes infertility? Is it just the female? Is it just the male? Or is it both of them together? Now, when we look at the male, there are many causes, but when we look at the assessment, then we look at one of the major things is performing a semen analysis test. It's a very simple investigative test. We only ask the couple to have a abstinence period of 3 days to 5 days. Now you need to understand the importance of this abstinence period. If it is less than 3 days, we get low count. So it's a compromised report, isn't it? It's just been 3 days since the last ejaculate, and if you are not able to get the right kind of volume, we give the report as abnormal. If it is more than 7 days or 5 to 7 days, then there are more immotile sperms. I won't say immotile really, but low motility sperms. So again, it's a compromised report because the sperms have been in the tube for so long that there are many factors that are influencing the motility. They are bringing down the motility of the sperms, whereby the report is again compromised. So the abstinence period is very, very critical. That's one of the reasons we ask patients to have an abstinence period of 3 to 5 days, between 3 to 5 to 7 days. So that's very important. Now, when it comes to the female, we insist on day 2 of periods for assessment, for the initial assessment. Like I said, why do we do that? I have explained. What do? We do a scan, a very simple scan to see whether the ovaries have calmed down and they have the right kind of eggs pertaining to her age. It's called antral follicular count. According to the age, we should be able to see good number of follicles growing. These follicles are where the eggs are growing. So imagine them like nests. Inside the nest is an egg, and that's where it's growing. The egg is not visible to the eye under no ultrasonography, but the follicle is growing very well, and that we assess, the size we assess to understand the kind of functioning of the ovaries that we are looking for. Antral follicular count should be around probably 8 to 10 if the age is under 30 years of age. So this is a good number for a normal menstruating woman. Once we do the scan of the ovaries, we also look at the uterus. Now uterus it's a bulky organ. We can look at the endometrium, assume that it is the right size and it has the right blood flow, but to look at it very, very extensively, we need to perform a hysteroscopy or a laparoscopy. But under this test that I am talking about, the scan, we can look at it to see if there are any fibroids present, if there are any polyps present, if there are any other anatomical defects, like only one part of the uterus is present. All those things can be assessed in this, the first initial consultation that you have with your fertility consultant. Now, what else do? We do hormonal tests. So on this day, like I said, the hormones are calming down, everything in the body is calming down and gearing up for the next period. We do what's called as day 2 profile. We look at your follicle stimulating hormone. That's the hormone which is the signal to the ovary for the next cycle, for the egg growth. Luteinizing hormone, again, it also causes egg growth and also the growth of endometrium. Then E2, which is the estrogen, then progesterone. All these help in not just the egg release, but also the growth of the endometrium. So it's a very, very critical balance of all these hormones, and that's what we're looking at to assess in day 2 profile. There is another very important hormone which is called anti-Mullerian hormone. It's called the AMH. This gives us an idea about the functioning of the ovary pertaining to your age. Now, if you are 30 and your AMH is 1.5 to 1.6, but if it is very low, like I'm talking about 0.5 or 1, it means that you're aging faster than your chronological age. So the ovaries are aging faster than your chronological age. So it's a very critical thing. AMH and a scan of the ovaries is what we correlate to understand what kind of treatment we need to give you. This is a very important investigation that we draw inference from to decide what treatment to give you. Then we also perform other tests like thyroid profile to see if your thyroid levels are fine, prolactin to see if there is any elevated level of prolactin, because that is caused by tumor in the brain. Prolactin also causes a lot of dysfunctioning of this whole cycle of periods and egg release and endometrial growth and all that. So that's another very important critical test. Now there could be the definition of female infertility could be divided into 4 major causes. Ovulation disorders, like I said, which could be caused due to age Now advanced age, as we know, after 40 the periods get irregular anyway, so that's a very critical part of the natural cycle. Once you age, especially after 35, the menstrual cycle becomes a little bit irregular, the quantity becomes scanty or more, there could be fibroids present in the uterus, there could be a lot of issues once the woman starts to age. So age is a very important factor when we are trying to assess the cause of female infertility. So that's very, very important. Now there is another reason, what I talked about, premature ovarian failure. So if your AMH is low and your scans shows that your ovaries are showing very few eggs and it's not correlating with your age, we call it premature ovarian failure. There could be many causes again. It could be a hormonal imbalance, it could be data shows pollution causes it, data shows pesticides cause it, data shows genetics are also playing a role here. So it's a very important thing that we are seeing and observing more and more rampantly as we look at patients in these times. You need to know more, you want to understand more, you want to, you've already had investigations that you want us to look at, please feel free to leave a comment or take an appointment on the numbers that you see on the screen and get in touch with us. Thank you.